moving on to the health sector, the World Health Organization Director General Tedros Adhanom Ghebreyesus has called on world leaders to brace up for future pandemics after Trump's withdrawal from pandemic agreement talks and negotiations. Well, this is like sounding a warning ahead of time before anything like the COVID-19 pandemic strikes again. Even after COVID-19, we've heard of, there's a pandemic, there's a new disease outbreak in China, in this part of the world, in that part of the world, but there's not been a widespread pandemic as we had in the COVID-19 pandemic era. I think that U.S. indicating plans to withdraw from WHO has really been a major shake, has caused a major shaking in WHO. Because funding, when it comes to funding, U.S. is responsible for a lot of funding that goes into WHO. And their presence as a member of WHO was a boost. It was reason for many countries to be part of WHO. You saw the Kenya issue when they pulled out of WHO almost immediately after President Trump had announced that the U.S. would be withdrawing from WHO. So if they did that, it means that over time, you may have more countries pulling out of WHO, further reducing their strength. But as an organization, international organization, saddled with the responsibility of creating standard when it comes to disease and pandemic management globally, when it comes to ensuring standard in health practice globally, worldwide, they are seeing that there could be problem ahead. So let's come to an agreement now on how pandemics in the future will be handled, so that we do not wait for a time where it happens, and with US pulling out, one other country that now has pulled out, funding is not coming as it should be to tackle it. There is no agreement as to what practices will be adhered to. So let's do that ahead of time.
Kenya has not completely pulled out.
Also with the US, it's an indication.
It's just contemplating and just contemplating whether on what direction, what decision to make, probably because they were influenced by the United States decision on trying to leave. However, for the WHO, Mr. Ghebreyesus, who is warning the nations ahead of pending pandemic and how this might be devastating. So one of the questions one should ask is that there's lots of research that is required, medical research, laboratory research that is required to produce a vaccine for any pandemic. In the early stage of vaccine development, researchers explore the idea for a potential vaccine. Vaccine development can take 10 to 15 years. 10 to 15 years of laboratory research, usually at a company in private industry, but often involves collaboration with researchers at a university. So for how long, when COVID struck, how long did we stay before we came up with a vaccine? So that's a question that I will leave to the medical practitioners to come answer. How long did we stay? Because it was rapid, a vaccine was out, and that we could take this to prevent that and to prevent it. Fine, even though they came up and said those pregnant women may not be able to take that, those who have underlying ailments will not be able to take this, those who are given to alcohol and drug intake will not be able to take that because it's going to aggravate the problem and their challenges, and which may lead to them dying. But it didn't take long. So globally, medical research has been on and is still on to preempt or think ahead of possible epidemic that may rise up and how to quell it. I think globally, with the way and manner COVID-19 was handled, even though we lost millions of people across the globe, with the way and manner it was handled, I think the world is somehow prepared for any other.
Do you think the world is really prepared?
I would say that the world is kind of somehow prepared for any upheaval in that aspect. And that's why did I say that? It's because of the way we actually moved in during COVID-19. And sometimes it could be in this part of the world, I'm talking about Africa, they see COVID-19 as, oh, we have everything locally to overcome COVID-19. So people who are afraid, then sometimes they also went and take the local spirit drink to wash their hands, to sanitize their faces, and some of them even gulp down bottles of it to, to keep themselves from any form of contamination or coming in contact with COVID-19. A lot of people at that time went down, start eating the increase. There was an increase in the eating and consumption of garlic, of ginger, of fruits, and
of things
of vegetables
that they believe could prevent the COVID-19.
No, not prevent. Actually, some things that will boost their immune system.
That's what we're saying. Why you boost your immune system? So that you're not able to contract it.
Sustain any attack and will be able to keep you. So they were able to do that, and some people were completely oblivious of any form of warning.
Some felt it wasn't real.
That it wasn't real. However, we knew of lots of people who made the news that went with COVID-19. So somehow I think we are prepared. And
I don't share that. I don't share that sentiment that the world is prepared for any pandemic. We do not pray for any pandemic to happen, but yes, we do know that these things do happen because each pandemic comes with its own peculiar challenge. So we can't say because the world was able to manage the COVID-19 pandemic. If we look at that, was the world really able to manage COVID-19 pandemic? Maybe we're saying that because in this part of the world, the death toll wasn't as high as what areas like Europe, Asia, and other parts of the world had. The severity of infections and number of people, the fatality wasn't as it happened in Africa. I think Africa was better able to cope with the COVID-19 pandemic, and our environment also helped. The temperature that Africa has also helped. The medical practitioners in Africa, how they handled it also helped. A lot of factors helped. But for Europe, it was not the same. They were not as lucky as Africa. So after that COVID-19 pandemic, world leaders gathered to say we need to talk about how to handle future pandemics in terms of the prevention, the preparedness, and how we handle it when eventually it happens. That's what the pandemic agreement is all about. But with US pulling out, the WHO is saying that this has to happen now or never. We need to make this a top priority now ahead of time. Let's decide on how future pandemics will be handled. There were countries that were disgruntled about the way WHO handled the pandemic. It was seen as though WHO wasn't fair, as they were giving concession to certain areas than others. Even from Africa, there were claims of a cure to COVID, medications that could treat COVID, but did they really listen? Did they test to be sure that, oh, there's a cure coming from this part of the world? But it seemed like there was this push of vaccines over claims of cure, claims of treatment for COVID-19 pandemic, which I think personally shouldn't be. Now, if you're giving people vaccines so that they are better able to stand against the COVID-19 pandemic to prevent the infection, if someone comes up with a claim of treatment, I think you should also listen to that person, because while you're preventing, the vaccine is not 100% proof. It's not 100% a safe proof that you would not be infected even after being vaccinated. So we saw that there was the first dose, second dose, and all that, and the booster dose. That's because the vaccine itself was, the potency of the vaccine was not 100%. So where there are claims of treatment, they also should have been given priority. So those are areas that leaders want to smoothen out to see if any other pandemic breaks out, how do we prevent it? What is going on? What preventive measure are we taking now to equip our health sectors in each country, globally? How are we training the workforce? What is the standard? Now, how are we prepared for it? If it does happen, are we investing in vaccines in certain areas? so that whenever there's an outbreak, we are better able to deal with it. We don't record as much casualty as was recorded during the COVID-19 pandemic. But, of course, with US pulling out, it seems like it's setback. But I think that it's just US and maybe Kenya. The other leaders can come around. I think this conversation needs to happen because we don't know when the next will happen and what nature that pandemic will assume. So it's very critical for the health sector to be top of its game, being proactive before anything happens.
For why we were able to come up with a vaccine within 1 year is a feat. Top universities in the United States...
there are different conspiracies around that even.
Top universities.
Okay. Like you don't believe in it doesn't mean that there are no conspiracies
what's
around
the conspiracy?
the
what's
ease
the
of development of vaccines. You by yourself said here that development of vaccines take between 1 to 15 years.
10 to 15
10 to 15 years. So in a year, or less than a year, vaccines were developed for an infection that was quite new. So do you not raise eyebrows at that? Let's not even get into that.
2019, COVID-19 came on board.
Yes.
2020, the world was able to come up with
yes.
a vaccine.
Something that before that time would take 10 to 15
The Pfizer
years.
vaccine was the first vaccine, I think, that hit the globe. And the United Nations, the World Health Organization, by virtue of the fact that it has a conglomerate of world health experts and universities in member states that are in alignment with the agenda of the WHO, carried out research on I won't want to say on daily basis, but okay, let me stop there.
Okay, well, let's not get into the debate of what happened during the COVID-19 pandemic, the conspiracies and all, but the bottom line here is that it is urgent. It is something that should happen. What leaders should, I think they should listen to what WHO is saying at this time regarding the pandemic agreement so that the world is ready to face any challenge that may happen health-wise so that we do not suffer what was experienced during the COVID-19 outbreak.